This frozen image is that of a 22 years old female, young, unmarried, with history of severe pelvic pain for the last 3 months, and because of socioeconomic condition could not consult some proper doctor, has been referred for ultrasound for the first time, and now you see that on this side of the screen, on the right side, you see urinary bladder, and there is a cystic area, this one, measuring approximately 5.2 into 4.0 centimeter. It's thick wall, this is the wall, and it's filled with echoes, and there are marginal, on the medial side of the cyst, marginal ecogenic particles areas seen. Okay, now this is on the left side of the left adnexa, you can say, and then this is the transverse section of the uterus on this side of the image, with this being the urinary bladder. To show you the ovary, this is the right ovary, and there are few developing follicles seen, though no developing big follicle is not seen. There are tiny developing follicles seen. So now let's see on the, okay, now so far as the vascularity is concerned, the edge margin is vascular. Here you see, this is the vascular margin. Internally there is no evidence of blood flow, and see the strong back wall, shear wall, strong back wall is seen. Now let's do it on a real time. This is the cystic area. First of all, let me show you the uterus. Now this is the uterus aligned with cervix and vagina. This is the uterus, cervix, vagina, longitudinal section, and when I move the probe transversely, here you can see there is a fluid pocket and filled with echoes and with no internal vascularity, measuring in total approximately 8.6 into 3.5 centimeter in total, and this is in the region of the left adnexa. As you see, this is the uterus in transverse section. Here comes the uterus. This is the transverse section of the uterus. This is the endometrial canal. The uterus is unremarkable, and this is this. Now you can see there are few tiny cystic areas, septas as well. No complete septa seen. They are incomplete, thin septas in the dependent portion of this tubular cystic area. And here are the ecogenic areas that we were seeing. Then you see these ecogenic areas are giving posterior shadow. So these are the calcifications within this cystic, within this eco-filled cyst. And this is this finding is very much consistent with left tubo-ovarian abscess. Thank you very much. Now you see this. I have frozen the pathology. Patient is very tender to this area in the region of the left adnexa. Patient is tender to the probe. Can't hold the pressure. You see the dependent region echoes are seen. Otherwise, it's also filled with echoes in the cystic area, thick wall. And these are the calcifications, tiny calcifications. These are poorly calcified. And from a different angle, we did solve some posterior shadowing from few of these. So this is in fact, and this is the transverse section of the uterus, and the endometrial canal is clear. So this study is very much consistent with Pyosalpinx, the left side, and most probably cold in this area. Thank you.